One of the other things you mentioned was clinical trials that you've participated. And I'd love your perspective as a patient, having gone through a trial, searching for trials. We often hear that may be a difficult process. But the other thing I'd like to kind of get at is, how advocacy groups and patients together can kind of dispel some myths about clinical trials. So I'd love your perspective on your experience.
I think that's kind of hard because I think I still have I'm still skeptical,
Sure.
I guess, about trials based on my experience.
Right, sure.
With the one that I went through with, it didn't work for me. It was interesting when I was at the foundation conference and I had the opportunity to speak there, I said, I failed the trial, and a doctor said, you didn't fail, the trial failed you, which is a great spin on it, and it makes sense. And so my thought was like, this is the way medicine is going with these trials, with the immunotherapy and like targeted therapies, and I want to participate so I can help, again, move things forward or help other patients in the future. But it's hard because I think back to how it didn't work for me. There's just a lot of unknown with trials.
Right. Was it difficult for you to find a trial? Did your healthcare provider help you with that? Because you hear about that all the time, how difficult it can be.
It can be really difficult. If your hospital isn't doing trials or doesn't have anything to offer you, I was fortunate enough the first time with my reoccurrence, my doctor there's a clinical trial doctor in the same building, same hospital, who he referred me to. And I still got a second opinion just to see what other hospitals had to offer, which is huge. I think everybody should do second or third opinions.
Absolutely.
So I was connected that way, but if you don't want to stick with your hospital and you want to go somewhere else, that's on you to research, to find somebody else. They're not going to say, yeah, you should definitely go up, to Boston or down to Maryland and check it out.
Right.
I'm going to those places now because we've talked about clinical trials again, but that's because my mom and I and my family have done the research of who's offering what, and we're doing it,
Right. Was it difficult, or is it difficult in that process to do that research on your own?
Yeah. Because all that medical jargon right over your head.
Right.
For me at least.
Absolutely. No, I hear that so often.
Yeah.
That it's very confusing.
There's clinicaltrials.gov, so you can plug in, like I typed in cholangiocarcinoma, and it lists the different trials. I don't know what half of that stuff means.
Right.
So I just look at the location and then, that sounds good. Maybe I'll give them a call and
see.
But you might not fit the criteria. It's overwhelming. It really is.
Right. Do you think, having gone through this process and going through it now, what more can we do, like as advocates and advocacy organizations? I mean, I think there's got to be more. That's a big question.
That is a big question.
But I think, maybe as a goal, the GI Cancers Alliance, for example, maybe we can work toward simplifying or making more sense of.
I think that would be great.
Of a trial finder.
Yeah.
Because I've heard that so often from patients and the other thing too is, when you're searching for a trial, you don't want to waste your time.
No.
I mean,
none of us. Like right now, I feel like a sitting duck. I was just told last week that, it's back in your liver and your lungs. So I met with a clinical trial doctor at my hospital, but then that's when my family and I started reaching out to other hospitals. So when you're doing this research and you're waiting for the call back, or you're waiting for, updated genetic testing results, you feel like a sitting duck.
Right.
Like, I know I have cancer in me, so let's do something. But
right, let's get you to where you need.
It's a process.
It's a process.
It is.
Right, but no, I think that would resonate with everybody listening to this. Is if you know the situation, you want to get it taken care of, like you want to get it going.
I think a lot of cancer patients, we're all a little impatient because no one wants to wait around.
Right, and I think too that kind of leads to you so often hear, and I that you kind of lose control. Like it's a situation where you feel like you don't have that control. But I think what you're doing, especially Sarah, is that you're taking that back. You're taking that control back.
Yeah, I never thought of it like that, but yeah.
Because you're out there and you're researching and you've got your ducks in a row, and you're like, I'm not going to wait around for whoever. So I think that's really admirable, and I think our listeners can learn a lot from that. And one of the things that I've learned too is that you know, and we mentioned our treatment plan, our survivorship care plan, but is to really look at different things at the start of your diagnosis, because you just don't know down the road. Hopefully you never need it. But if you do, it might be there and you'll be like, oh yeah, I do remember X trial or X treatment or whatever that might be. And then if you have that kind of in your back pocket, then you know that it's something you can reach for. And I think too with our survivorship care plans and treatment plans, it does kind of take a situation. If you have all your information in one place, it gives you that sense of control. Like you have that, you know, those documents, and you can be like, you know, hey, I do.
I have a big binder full of everything.
That's one of the first things, you know, we always recommend, because then you have it and you don't have to wait for test results to be sent, or they were lost, or they weren't faxed right, or something like that. So you may be traveling then again for a trial in your future, or maybe even here.
I'm hoping to stick with my hospital that I've been with for 3 years. I know them, they know me, I feel very comfortable.
Absolutely.
But if somebody else can offer me a different chance that might benefit me better, then I'm going to go there.
Right. And I would assume your healthcare team, because it seems like you're very close with them, they would be very, you know.
Oh yeah, definitely supportive of getting other opinions, and I mean, they encouraged it.
That's great.
And I have some friends who say their doctor is kind of like, you don't need to do that, we have it here. Don't let a doctor's, ego get in the way of your health care.
Right.
You want a second opinion, you have third, fourth, you have every right to that. So do it.
Absolutely. Because I think, I think the bottom line is, we're kind of that co-captain of the ship. And, if we're not going to fight for our health and our well-being, who is going to?